Hi, I'm Peja Stojčić.
And I'm Ella Auchincloss. Together with a team of talented professionals, we lead the Hospital System Transition Planning Project for the ReThink Health Initiative here at the Rippel Foundation.
Hospitals are under a lot of pressure. They have to manage multiple transitions at the same time. They're facing what we call a problem of balancing two boats while the stream is moving really fast. For example, hospitals are moving from fee-for-service to value-based payments. And at the same time, they're transitioning from a provider-centered mindset to a patient-centered mindset. These are big transitions, and they bring up a lot of questions about how to handle the tension between where we are right now and where we are going. So what's producing all of this tension? Well, hospitals often feel caught between the business models that keep them afloat and the realities of what we understand about what produces health and well-being in their regions. Hospital systems are forming their own interpretations about to handle and respond to these pressures, but we believe that there's an emerging, all-important question that is being overlooked in all of these interpretations. A question that needs to be answered first. That is, what role should hospital play in their regions?
Wow, that's a really big question. It's not clear what the answer is and what the transition to any new role might look like. What new business models, work cultures, and responsibilities will be needed for any new role? Without clear roadmaps and endpoints, many hospital leaders are understandably reluctant to begin a journey like this. Yet some are finding the courage to take the lead. These leaders among leaders are stepping up and finding a way to determine the desired endpoints so they can construct the roadmaps themselves. ReThink Health's Hospital Systems Transition Planning Project is identifying a handful of them as partners who are ready to stand at the forefront of this challenge and begin to pave the way forward.
In a quick look into the history of hospitals, we found that U.S. hospitals have transformed themselves at least 4 times in the eyes of the people they serve. They've gone from being perceived as almshouses and houses of debt in the 1700s and mostly funded as charities, to the homes of science and knowledge 100 years later due to the birth of nursing and surgery. After the Great Depression, it was a period of substantial regional and national investment in our community's hospitals, which ultimately shifted in the 70s and 80s to the hospitals being perceived as big business. We see that hospitals are on the precipice of another big shift in this new era of population health. The big questions are, what will be the next dominant perception? Who will decide and shape this perception? And how will hospital system leaders bring any new perception forward? At ReThink Health, based on the decade of high-profile work identifying how stewards can equitably transform health and well-being in their regions, we believe hospital leaders will want to be seen as stewards. Stewards are people and organizations who take responsibility for working with others to drive transformative change in their regions, and in this case, the health and well-being of people. ReThink Health believes that active stewardship among key players in a region is the most effective path to population health.
Professionals from many sectors are already taking on this role, partnering with others to transform health and well-being, hospital leaders included. For example, some hospitals have defined themselves as anchor institutions and are committed to the responsibilities that title entails. Such institutions affect their region's health and well-being by recognizing that as large institutions, they have a major economic imprint in a region, and they must act accordingly to benefit the region's economy and people. For example, they might decide to hire or source locally, or invest in green buildings. Other hospitals have opened population health management departments to improve aspects and conditions that influence health outcomes of individual patients to maximize population health. And some hospitals lead their local accountable care organizations.
Early innovations like these are beginning to shape what it would mean for a hospital to embrace its role as a regional steward. But without a clear understanding of what endpoint hospital leaders are pursuing, in terms of the kinds of stewards they want to be, and what that will require and result in over the long run, it will be really hard to know if these efforts are successful, much less if they are the most fruitful efforts to be involved with in the first place.
ReThink Health is partnering with 3 pioneering hospital systems, ready to explore and define their role as stewards of their region's health and well-being. We are working together in relationship with the hospital's internal and external constituencies to determine any new role and what it might take to transition to that role, including the possibility of negotiating a new set of community relationships and partnerships, and mapping and navigating internal organizational obstacles and responses. What qualifies us to do this work? Well, we spent the last decade working with multi-sector partnerships and regional leaders building their capacity as stewards of regional health ecosystems. Among other work, we've created a systems dynamic model that has helped regional leaders plan their long-term strategies for change. And our 7-year-long partnership with Centers for Medicare and Medicaid Services Quality Improvement Organizations gave us a unique experience with internal challenges that healthcare providers face in developing a new and more collaborative culture. This project will allow us to bring all that experience to hospital systems, one of the key stewards in any regional health ecosystem.
With these new relationships and understandings, hospital leaders will be able to determine what it means for their own hospital system to be a steward, working in collaboration and alignment with other people and organizations in their region to create lasting change.
What we find will serve as a guidance for pioneering hospital leaders in other regions who can build on the early lessons of what's involved in shaping and transitioning to a new role. We look forward to sharing what we learned with all of you, and please be in touch with your stories and insights. We'd love to hear what you're thinking about. Think with us.